So I don't know if you can see that down there. Those are fire trucks. And this morning I was woken by a police officer banging on my door because the house next door was on fire. And I know what you're thinking. You're thinking, Nick, what the hell does that have to do with hip surgery? Well, I had to climb up on my roof. I had to get a ladder. I was hosing down the roof. I was doing all kinds of things five weeks after hip surgery. And I think there's a lesson in here. I'm going to tell you today why I think getting hip surgery is such a good thing. You know I'm not a doctor. This is not medical advice, all right? Let's get that out of the way, please. Prior to my hip surgery, I was on YouTube looking like what to expect with the anterior approach, hip surgery. I couldn't find anything that wasn't put out by like a doctor or a medical center. And being a YouTuber, check out my channel, being a YouTuber, I made this video, and then post-surgery, I made a video at 1 week, at 2 weeks, at 4 weeks, and I'm gonna make one at 6 weeks. If you're watching this video, chances are that you're having a problem with your hip. And my goal here is to kind of share what I've learned. I've had 2 hip surgeries. I've had one where they went in through the back in 2009, and I had another one 5 weeks ago where they went in through the front. And the fact that I was just running around, getting on my roof, hosing down my roof, kind of running around like a chicken with my head cut off, well, this second surgery, man, it is so much better than the first surgery. And that's because they use something called the anterior approach, where they go through the front. So yeah, I'm a big believer in that approach. And if you can make sure your surgeon uses that approach, or find a surgeon who's practiced in that approach and talk to them and make sure you're eligible, I think it makes a big difference in your recovery. Which leads me to my second point. You know, I've gone through this twice, and one of the most important things, and I have to say both times, I had a lot of comfort and a lot of faith in my surgeons, okay? I did my research, I talked to people, I talked to the surgeons, and by the time I was in that operating room, both times, and they put me under, I was fully confident that I was in good hands. Look, I'm not a doctor, and so this is not medical advice, okay? This is something between you and your surgeon. But what I want to say is, don't wait too long for this surgery. The first time in 2009, I waited too long. I was in pain. I was taking a lot of anti-inflammatories. I was doing everything I could to avoid the surgery. And in hindsight, that was just a bad idea. After the surgery, I felt so much better. I was pain-free, and I was a fool for waiting so long. If your surgeon sees things and says, yeah, it's time, listen to them. In fact, don't wait. Go get the surgery, get your recovery started, because your life will be so much different and so much better for most people after the surgery. If you've decided to get the surgery, please, 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 please make sure that you're doing everything you can to be in the best shape possible. Every little bit of work that you're able to do, even with that hip hurting you, before you go to surgery is going to pay dividends in your recovery. And if you can lose a little weight, if you're a little bit overweight and you can drop some pounds, that's another thing that is not only going to make your surgeon's job easier, it's just going to make your recovery that much easier. Moving around, using a walker, using a cane, those types of things, it's going to make it way easier to deal with the surgery. So do your best on that front. Another huge difference between 2009 and what I had done just 5 weeks ago is the pain management. The way that they kind of approached that was radically different. It seems like 10 or 11 years ago, they just gave me drugs and kept me in bed and didn't want me doing anything. And this time, my pain was really super well managed. So understanding how your surgeon, how that team is going to approach your pain management, I think is super important. And then having someone, especially when you get home, who can manage that for you. Like without my wife giving me this pill and that pill, making sure that I drank water, getting ice on my leg, doing all of these things at first until I could do it for myself, I wouldn't have been running around on my roof with a frickin' hose if she wasn't around making sure that all of that happened. Make sure you stay on top of the pain. For me, there was a period where I felt like, okay, I can get off the oxy. I think it was like 5 days in, and that was a big mistake, because when I was doing my physical therapy and doing my 3 times a day walk with my cane, the pain came back in a big way in my hip, and I got back on the oxy. I want to spend just a second on ice and elevation, because it was such a big difference, I think, for me between 2009 and the surgery I just had. The role of ice in keeping the swelling down, keeping that leg elevated, really made a huge difference for me in the reduction of the swelling. I mean, they're still swelling. I mean, they were in there kind of messing about, so you're gonna have some discomfort. But I had 2 really large ice packs, and I was icing probably 5, 6, 7 times a day, and as much as possible, I had that leg elevated. And I really believe that made a big difference in how quickly I was able to go from walker to cane to actually walking. So to wrap this up, here's what I would say. I would say that of all of the surgeries that you and I could be faced with, hip surgery sounds pretty daunting, and in fact it is. I mean, it's freaking major surgery, but you're gonna get through it. Chances are your surgeon has done a lot of these, and he's seen what's going on with you and is going to be able to deal with that effectively. And when I A/B it, when I think about how I felt before versus how I feel after, the difference is freaking huge. And I would really encourage you, if you have this problem, don't wait. Go get it taken care of, because if that hip is interfering with your mobility, if it's interfering with your ability to do the things that you like, to be active, to walk, I don't know, whatever the things are that you like to do, you deserve to have that pain behind you. And as someone who has now gone through this twice, trust me, it is well worth it. Go get it done.